Hi everyone, we're here studying the cardiovascular system. We're going to just go in detail really quickly. It's really a summary, but hopefully we'll go in enough detail for you. Alright, so this is basically what your lungs and heart looks like. Of course, it's not drawn to scale and it's not exact or precise, but this should give you a good idea of how everything looks. So we're focusing first on the heart. Ignore all this stuff over here, okay? So let's see. Oh, okay. All right. So we're first on the left side on the right side of the heart. So I need you to remember this. This is the right side of the heart and this is the left side of the heart. Imagine your heart flipped around. So envision yourself, put your hand on your chest. What is what is on your right side is over here. This is something that gets a lot of persons when they're studying. It's important for you to know the difference so that you don't mix it up. So left is right, right is left when you're looking at it on a diagram, okay? Or on somebody else. So this is the vena cava. These are the vena cava, yeah. This is the superior. It brings blood from the head. And this is the inferior vena cava. Brings blood from the trunk. So the legs, the abdomen, everywhere else. All right, so both of these meet and they enter. So I've kind of done a little cross section here. So you're seeing inside and outside at the same time. So on the inside, we are having the blood come in through these little holes and they're coming into the right atrium. Now, the right atrium has valves here, a set of valves called the tricuspid valve, and I'm just going to put 3 here so that you don't forget. So they kind of clasp, they open and they clasp shut. Now when the blood comes in, because of the pressure that's they're coming in with, these open and the blood passes through. When the blood has passed through and is now in the right ventricle, then these 3 valves, the tricuspid valve, they snap, the leaflets rather. So these are each leaflets and the leaflets make up the valve. They snap shut again, like a snapback shut. So, and you can actually hear it happening within the body. You hear it lub dub, yes. Now the blood at this point, I'm using the wrong thing. The blood at this point is going up into the pulmonary trunk, which is right here. Of course, once again, these valves open and then they snap back shut. So we know that part. Now this is where it gets important for us to memorize. Now let's come over here for a minute and let's just write down something that is really important for us to know. Now arteries and veins, let's put the veins in blue, are 2 important blood vessels in the body. The arteries carry blood away from the heart. So A, as we said earlier, A is for away. And if A is for away, then whatever is left would be towards. That's just the way to remember it. So arteries go away, veins go towards. They carry blood towards the heart. Now, there's a difference with what they carry, though. Generally, arteries will carry oxygenated or oxygen-rich blood, so blood that's full of oxygen, and veins will generally carry blood that doesn't really have so much oxygen, so it's carbon dioxide rich. However, when we're talking about the lungs, so that's the pulmonary circulatory system, because, oh, I didn't go into that part. We have 2 circulatory systems. We have the pulmonary, pulmon means lungs, and we have the systemic. So the pulmonary system is where the heart pumps the blood to the lungs. Ignore these rough sketches. Gets oxygenated or oxygen rich, and then it pumps it back to the heart. And yeah, that's literally just the entire pulmonary circulation. Systemic circulation is from the heart, the oxygen rich blood that comes back from here to the rest of the body. Let's just draw a person real quick. Okay, that's a terrible drawing, but okay. We have through the rest of the body, so that includes the trunk, the legs, the torso, the arms, the head, everything, and then back to the heart after all of the organs and tissues and everything else have used the oxygen that it needs. So this would be carbon dioxide rich blood. So coming back to this, in the pulmonary system, arteries carry deoxygenated blood. So blood with carbon dioxide, because it's going to the lungs for the oxygen. In the systemic circulatory system, arteries carry oxygenated blood because it's carrying the oxygen rather, to the tissues and the cells and everything that needs this oxygen. So if you remember the reason behind it, it makes much more sense. When it's going into the pulmonary system, pulmonary circulatory system, circulation rather, then it is going to be carrying carbon dioxide rich blood because it needs to be refilled. After it's been refilled in the systemic system, it's going to have oxygen rich blood because it's already been filled. All right. So at this point, we're going back to the heart, and we're looking at the pulmonary veins. So rather pulmonary arteries. See, I'm getting it wrong. Pulmonary arteries. So it carries it to the lungs. We have 2 lungs, so it's going on both sides. Now I've done a blow up of an alveolus, and we know the plural for alveolus is alveoli. So you're kind of getting a recap of the respiratory system as well. Now what happens is there is a very thin blood vessel here called a capillary. This is a capillary, and it surrounds the alveolus. It goes all the way around it. Now what happens is that the blood is transported, the blood cells, they leave from here, they come in here. It's 1 cell thick, so only 1 cell can pass at a given point. Let's see if I can erase this. Wonderful. So it comes in here and it's passing through. These are all blood cells passing through. Give them a little space so that you can clearly see what's happening. Now within the alveolus here, we have carbon dioxide and we have oxygen, because this is a continuous cycle. So it's not, we slow it down for the purpose of teaching, but it's not a 1 minute and then the next set of red blood cells. No, it's continuously happening. So there will always be a certain level of oxygen and a certain level of carbon dioxide within the alveolus. And this is important for maintaining the pressure, because if the pressure drops or changes at any point, then we're going to have problems. And that's something that we'll go into with more detail in the respiratory system. Yeah. So let's just come back right here. So we have the carbon dioxide being dropped off by the cells, and then the red blood cells, that is, and then we're going to have them picking up the oxygen. And we're just, of course, they don't have these colors, but just to make it easier and more visual, we're having the oxygen rich blood being red. Now they are now oxygenated, and they're coming back, and they're entering through the pulmonary veins, because remember, veins always carry blood towards the heart. So we're going back towards our heart, and we go in on both sides. Now these lead to here, okay? Try to follow with me. All right, but we don't want to do a cross, so we're just leaving it there. So they enter, and what do they enter into? They enter into the left. Remember, right is left. Left atrium. So on the paper, it looks like it's on the right, but it's actually the left. We did this. Don't forget it. It's important. Because when you look at a patient, this is how the patient is going to be. Patient is going to be like this, and you need to remember that this side is the patient's right side, and this side is the patient's left side. So your right is my left, and your left is my right. So what I look at is the opposite of what it is. Okay, now everything comes down into the left atrium, and then once again, I can't bother to draw these over in the green, so we're just gonna, they open. This is the bicuspid valve. You realize it only has two, right? The blood passes through. This is all oxygenated, oxygen rich blood, and it comes up. This goes behind, okay, but to not have the cross, it comes up and it is pumped. Now this is the left ventricle, by the way. Now the left ventricle is very powerful. It has a very powerful contraction, and that pushes the blood, because this contraction carries the blood from this little space in the heart to your head, your arms, all the organs in your torso, to your legs, your legs, to your toe point. Everywhere in the body. So this is a very powerful contraction. It pushes it up through the aortic valves, and by the way, these are the pulmonic valves, okay? Yeah. And then into the aorta. This is the aorta. Some of it goes to the head, and the rest of it goes down towards the rest of the body. All right, so this is a pretty brief recap of the cardiovascular system. Well, really just the heart function, because there's so much more when it comes on to the cardiovascular system. We have to look at the we have to look at, you know, what else is in the blood, the different components of the blood, all those different stuff. But this should give you a pretty good visual and a good recap. If there are any questions that you have, please let me know. Thanks for watching.